The Incidence of Cranial Arteriovenous Shunts in Patients with Pulsatile Tinnitus, a Prospective Observational Study. By N.T. Veld, Matthijs, Fronczek, R., Laat, J. A., Kunst, Henricus P.M., Meijer, Frederick J. A., Willems, Peter W. Avia Otology and Neurotology published ahead of print. Objectives: finding the underlying cause for pulsatile tinnitus can be challenging. We aim to determine the incidence of arteriovenous shunts, that is, arteriovenous malformations, AVMs, or dural arteriovenous fistulas, DAVs, in patients referred for catheter angiography, digital subtraction angiography, DSA. Furthermore, we assessed which clinical features were predictive for the presence of such a lesion. Study design and methods: 51 patients with pulsatile tinnitus, who were referred to us for DSA to exclude an arteriovenous shunt, were enrolled, prospectively. Main outcome measures: DSA determined the presence of a DAV4 AVM. Clinical characteristics were recorded systematically and all patients underwent a physical examination. Results: 50 patients were included in the final analyses. While no AVMs were found, a DAV was found in 12 cases, 24%. 3 of these demonstrated cortical venous reflux, thus requiring treatment due to the risk of hemorrhage. In 3 cases, 6%, DSA demonstrated a non-arteriovenous shunt abnormality, likely causing the tinnitus. The odds of having a DAV were significantly raised by unilaterality, objective brute, and the ability to influence the tinnitus with compression. Unilaterality even had a negative predictive value of 1 and, if used as selection criterion, would have raised DAV prevalence from 24 to 32%. Conclusion: in a tertiary care setting, the prevalence of DAVs in patients with pulsatile tinnitus is not negligible. Thus, patients with unilateral pulsatile tinnitus should be offered dynamic vascular imaging to rule out a DAV. Especially, since some of these patients are at risk of intracranial hemorrhage and treatment options exist. Address correspondence and reprint requests to Peter W. A. Willems, MD, PhD, Department of Radiology, Internal Postage, C2S, Leiden University Medical Center, Albinusdreef 2, 2333 Leiden, the Netherlands. Email: p.w.a.willems@lumc.nl. None of the authors have a conflict of interest regarding the techniques and materials described. Copyright 2018 by Otology and Neurotology Incorporated. Image copyright 2010 Wolters Kluwer Health, Anatomical Chart Company.